Hello everyone and welcome to the webinar of the NSS unit of Women's Christian College. The welcome of today's webinar will be given by our respected Principal Madam, Dr. Ajanta Paul. Now I would request to our Principal Madam to give the welcome address of the webinar.
Thank you, Shomnath. It is indeed my proud privilege to deliver the welcome address for today's one-day state-level webinar on the topic, the prevention and safety measures of dengue and other vector-borne diseases in the COVID era. And our speaker this afternoon is Dr. Prabir Kumar Shaw, lecturer, the Calcutta Homeopathic Medical College and Hospital, Kolkata. Now, I'm sure we all agree that the topic that we have chosen for today's webinar is indeed a very, very relevant one. We are in the midst of a rampaging pandemic, and we really don't know what to make of it or how to negotiate the present or the future. And in this kind of a situation, we are perhaps more forcibly reminded of, the usual diseases that used to be our lot in life. And these are among these usual diseases are the so-called vector-borne diseases. Now, what do we understand by vector? Vector means these little organisms, the mites, ticks, mosquitoes, fleas, and so on. And they live in an animal or human host, and they carry the infection from person to person in this manner. And the diseases which typically, emanate from this kind of transmission are dengue, malaria, filaria, and Japanese encephalitis, and typhus, and various kinds of fevers, among others. And in India particularly, we have seen that, we tend to fall prey to these diseases, and it is a huge burden on the state machinery, on the healthcare infrastructure, and so we have to be careful that we don't contract these diseases, right? So as good citizens of the country, we need to be alert about these diseases and also try and spread awareness about it. Each of us have a responsibility, and so there are certain do's and don'ts at a very basic level, such as don't allow the water to collect in vases, in AC coolers, in coolers, cooler tanks, in cisterns, and in other places, and take various preventive measures. So there are a great many things that we can actually, measures that we can adopt. And so as responsible citizens, we need to think about it, we need to practice these things, and as far as possible, spread knowledge, spread awareness of it in to as many people as we possibly can. Now, having said that, I'd just like to take 2 minutes of your time dwelling on our NSS unit in Women's Christian College, and we have a long and rich tradition in social work, and I am justifiably proud of the NSS unit in the college, and we have had this number of coordinate program officers sequentially, beginning with Dr. Nivedita Raha, after whom we had Dr. Nabunita Mitro, and then we had Dr. Gini Bhattacharya, and now we have Dr. Shomnath Hajra, and two joint coordinators, Srimati Adarshila Chatterjee and Sri Ashim Chakraborty. So this is a tradition which is, being continued, and our volunteers, our student volunteers were wonderful, in the discharge of their work in this area. And Debolina was also, of course, Shomosri, sorry, I forgot Srimati Shomosri, Roy Chaudhury's name. Shomosri and Debolina Gopalan were also very active in this entire what you call project, and they gave the NSS unit in the college a wonderful identity. It is not the doing of any one person, but all the coordinators, all the program officers, and the faculty members who were involved in this task, combined to raise the bar, and they took it to another level altogether. And whenever they invited me to these programs, I always felt so proud of the unit in the college. And it was a real treat looking at the students, the volunteers, grow as human beings right before our eyes. The 2 years that they got to spend, engaging in social work, I, for one, and I'm sure our teachers also have seen how they came into their own and how they led the charge, so to speak, and how responsible they were in disseminating, good ideas and practices in local society and beyond it. And having said that, I welcome our speaker this afternoon, Dr. Prabir Kumar Shaw, and he is the expert in this area, and I'm sure we are all going to be considerably enlightened by what he is going to share with us, with our students, and hopefully, students, you will carry some of this with you and spread it in your area, in your locality, the people you come into contact with. And that will really help to make this program a meaningful one. So we are all equally partners in a wonderful enterprise that is to make our local society, our city, our state, and our nation a good, hospitable, habitable, healthy place where we can have a free and frank and fair exchange of ideas. So I welcome all of you, our speaker, Dr. Prabir Kumar Shaw. I welcome our faculty members, our NSS unit uh, faculty members, and the volunteers, and all other students who have gathered here to partake of the fruits of this deliberation and to take away with them something that is likely to remain with them. So once again, I welcome all of you to this state level seminar, which has been put together so meticulously by Dr. Shomnath Hazra, by Adhashira Chatterjee, and Oshim Chakraborty, and of course, my dear students, without whom nothing can take place and nothing is ever complete. So, with that, I close my welcome address. Thank you very much.
Thank you, madam, for your warm and inspiring speech. We are thankful to your insightful guidance and encouragement at all times. My name is Shomnath Hajra, and now I am going to introduce today's speaker, Dr. Praveen Kumar Shah. Dr. Shah has completed his BHMS from the Calcutta Homeopathic Medical College and Hospital, Maniktola, and MD from the National Institute of Homeopathy, Salt Lake, Kolkata. Dr. Shah has started his career as a senior research fellow under Central Council for Research in Homeopathy, Ministry of Ayush, Government of India. There, he was engaged in different research projects like osteoarthritis, rheumatology, and many others. For a small period of time, Dr. Shah also served as a medical officer in ESIC Medical College and Hospital, Joka, Kolkata. There, he provided healthcare facilities to the patients visiting the OPD, having number of varieties of complaints. Dr. Shah was research officer, scientist 1 for the 2 years at the Central Council for Research in Homeopathy under Ministry of Ayush, Government of India. Dr. Shah attended and gave lectures on the health-related awareness programs like general health and hygiene, mental health, etc. He conducted health awareness camps in rural and urban areas, providing healthcare facility to the patients and engaged in different field survey and research projects like cessation of smokeless tobacco addiction, lifestyle disorder assigned to him. Due to his nature of job, he experienced a diverse knowledge regarding vector-borne diseases throughout India. In 2020, Dr. Shaw joined as a lecturer at the Calcutta Homeopathic Medical College and Hospital, Maniktal. Today, Dr. Shaw will deliver his speech on the prevention and safety measures of dengue and other vector-borne diseases in COVID era. Now it is over to Dr. Shaw.
Am I audible, Dr. Hajar?
Yes,
Okay, okay. Thank you, Dr. Hajar. Very good afternoon to all of you. Respected Principal Madam, Dr. Ajanto Paul, Women Christian College, Kolkata, Dr. Somnath Hajra, Miss Adarsila Chatterjee, and Mr. Asim Chakraborty, member NSS, and all other professors, members, and today's delegate. Myself, Dr. Praveen Kumar Sahu, would like to extend my warm regards to all of you. Today's topic given to me is very interesting and relevant in this pandemic COVID situation. The dengue and other vector-borne diseases have really become a burden of our social and economical growth. In previous years, the approach, the interventions, the guidelines, the safety measures of dengue and vector-borne diseases were routine or usual. But this year's or in coming years, due to existence of this pandemic COVID, the actual approach of this dengue and vector-borne diseases will be little different. I will try to discuss different aspects of preventive and safety measures of dengue and vector-borne diseases in details, but the topic is vast. So I will try to cover everything in a very precise and truthful way. So uh, I'm going to present my presentation. Dr. Somnath, is it visible my PPT?
no, still not.
Now I have already shared.
Yes, sir, it is visible. Your presentation is
Oh,
visible.
Okay,
yes,
okay,
yes.
okay, okay.
Thank you. Thank you.
Okay.
Thank you.
So today's topic is prevention and safety measures of dengue and vector-borne diseases in COVID era. So without delay, I'm starting my first slide with introduction. What World Health Organization states that control and prevention of vector-borne diseases are emphasizing integrated vector management, which is an approach that looks at the links between health and environment, optimizing benefit to both. So, what is the outcome? WHO always trying to approach is integrated, which is a formation of network or connect between health and environment, so that the benefit will be both. Now, moving forward, the basic information regarding what is vector and vector-borne diseases. A vector is defined as an arthropod or any living carrier that transports an infectious agent to a susceptible individual, such as mosquito, ticks, flea, and vector-borne diseases that results from the infection transmitted to human by blood-fed arthropod such as dengue, malaria, filaria, etc. What the actually vectors do? These are the vectors are blood-sucking insects which injects disease-producing microorganism during a blood meal from an infected host, and later they transmit it to a new host. Often, once a vector becomes infectious, they are capable of transmitting the pathogen to rest of their life during each subsequent bite of blood or meal. Now, some information regarding prevention. The word meaning of prevention means action of stopping something to happen. But in case of disease prevention, we can say it is a procedure through which an individual, particularly those with risk factors for a disease, are treated in order to prevent a disease from occurring. Treatment normally begins either before signs and symptoms of the disease occur or thereafter. So here the risk factor is present. If we are able to find out the risk factor, every aspect of our life, in society, in disease condition, everywhere, then we can able to prevent the disease to occurring. And this is our primary job. So a doctor or a healthcare provider cannot always be there to give his curative application or therapeutic or medical application, but his role is also to prevent the disease before happening, to identify the risk factor in our surroundings. So the golden words written in our books, and we all know that prevention is better than cure. So always it is better to prevent anything. It is better, easier to stop a illness from happening than to stop or to correct it after it has started. So it is better to prevent. Now, what is safety measures? They are the activities and precautions taken to improve safety, reduce risk related to human health. So these are basically precautions. What I will discuss in our later side, what are the measures we can take. Moving forward, the determining factors. Distribution of vector-borne diseases is determined by complex set of demographic, environmental, social factors, global travel, and trade, unplanned urbanization. These are the determining factors. In this regard, WHO issued reports indicating that vector-borne illness affects poor people, especially people living in an area that do not have adequate level of sanitation, drinking water, and housing. So these are the factors associated which determining which helps the vector-borne diseases. Now, what we can see miraculously that 1/6 of the illness and disabilities suffered worldwide is due to vector-borne diseases. That is the magical 1/6. And vector-borne disease accounts more than 17% of all infectious diseases. It is responsible for 17% of all infectious diseases and causes more than 1 million deaths annually worldwide. So the number is much. A crucial element in reducing the burden of vector-borne disease is behavior change. What our behavior? So, what is the main thing? In this regard, WHO works with partners, different stakeholders, to provide education and improve public awareness, what is gradually lacking, so that people know how to protect themselves first and their communities from mosquito, ticks, bugs, flies, and other vectors. So it is our responsibility. Now, National Vector-Borne Disease Control Program is an umbrella program. It is launched in the year 2003 and 4 for prevention and control of vector-borne diseases like malaria, Japanese encephalitis, dengue, chikungunya, cholera, lymphatic filariasis. Malaria, filaria, Japanese encephalitis, dengue, chikungunya are transmitted by mosquito, whereas cholera are transmitted by sandflies. The transmission of vector-borne diseases depends on prevalence of infective vector and human vector contact. This is a very important point. Human vector contact, which is further influenced by various factors like climate, sleeping habits of the people, density and bite of the insects or mosquitoes. So these are the factors. The NVBDCP strategy comprises early diagnosis of the case, prompt and complete treatment. These two things are required to avoid unusual complications of health hazards of the patient. So these things are required. Then the third strategy is integrated vector management, which includes promotion of personal protection measures, insecticides, treated bed net, biological control measures like larvaviral fish, etc. Then is behavior change communication, which is our responsibility. Then capacity building through integrated training at all tiers of healthcare delivery system. In this regard, I want to say that healthcare delivery system in India has three tiers. First one is primary level, then secondary, then tertiary. The primary levels are sub-centers and primary health center. What in our locality we first boast in our primary health center. These are the primary health center, PHC or sub-center. Then secondary, that is community health center or district hospital. And last one is tertiary level, that is medical college institutions. So the training program or capacity building program must be go in the all the tiers of the healthcare delivery system. So the training must be gone through from ground level to top. So every healthcare provider must know the referring systems, referring systems, referring systems, referring systems,
We are encountering some technical issues. I would request the audience to please stay online. Dr. Shao will be back online shortly. So please be patient and stay online.
ever. Is it visible?
Yes, sir, it is visible.
This introduction. What integrated vector management, that is rational decision making process for the optimal use of the resource. So it is actually decision making process. While facing the current challenges of vector control, this integrated vector management is vital to achieving the national or global target for vector-borne disease control. Next is disease management. Disease management is early case diagnosis, rapid response, referral system, complete effective treatment. So these are the roles of the actually healthcare provider. Next is supportive intervention. Supportive interventions are like our behavior communication, intersectoral coordination, human resource development through capacity building. These are supportive. So, and last one is protection against bites. So this is our responsibility to protect ourselves from insect bites. Among the whole discussion, first one, integrated vector management, that is the actual important thing. And uh, the healthcare provider and administrative level, whoever work on this, and the successfulness depends on this integration. Now, dengue. Uh, dengue, we all know, are the arrovirus capable of infecting humans and causing disease. The vector of this disease is Aedes aegypti, transmitted by human by bite of infected female Aedes mosquito. This infection may be asymptomatic or may lead to clinical dengue fever or dengue hemorrhagic fever without shock or dengue hemorrhagic fever with shock. So these are the presentation. So I will not go this part. So global burden of dengue. These are the some information very relevant and important I would like to share that about 3.9 billion people in 128 countries are at risk of infection with dengue virus. A recent estimate indicates 390 million dengue infections per year, of which 96 million manifest clinically with any severity of disease. The number of reported cases have increased from 2.4 million in 2010 to 3.2 million in 2015. You can see the number of increase of cases. Not only the number of cases are increases, the disease is spreading in new area also. This is our challenging part. Gradually the disease is spreading new area, but explosive outbreak are also occurring. The year 2016 was characterized as a large dengue outbreak worldwide. This was the worldwide large outbreak. The number of dengue cases reported to WHO increased over eightfold over the last 2 decades, from 5 lakhs 5,430 cases in 2000 to over 2.4 million in 2010 and 4.2 million in 2019. It is a dramatically increased. Reported deaths between the year 2000 and 2015 increased from 960 to 4,032. Worldwide, annually about 5 lakh people with dengue hemorrhagic fever requires hospitalization. Approximately 90% of them are children aged less than 5 years. About 2.5% of those affected to die. This data actually very relevant, and we must know about the increase the different parameters or data of these cases of dengue diagnosis and death. It is really matter of worry. Now, distribution and outbreaks of dengue. Before 1970, only 9 countries has experienced severe dengue epidemics. The disease is now endemic in more than 100 countries in the WHO region of Africa, America, Southeast Asia, West Pacific. The America, Southeast Asia, West Pacific region are most seriously affected, with Asia representing 70% of the global burden. That is the point of discussion, that Asia represents 70% of the global burden. Now, Indian scenario. What National Vector-Borne Disease Control Program data reveal that over 1.5 lakh people were diagnosed and estimated 166 died from dengue in 2019. Go further back, NBPTCP data shows that 2017 was a worst year in India. 1.88 lakh people diagnosed with dengue and the death count is 325. Moving further, the reasons for increase of dengue cases in India in recent years. Why the cases of dengue increases? So, the large population size, lack of awareness and education, poverty, rapid urbanization, lifestyle changes, and deficient water management. So these are the burning problems. So it is a matter of concern. So the serious lack of awareness in our society, and the poverty is linked with this, lack of education in them, rapid urbanization, lifestyle changes. So gradually modern civilization, we forgot to clean our society, we forgot to make our surroundings making it hygiene, we forgot to change water accumulated in our society. So these things gradually helps to build up the mosquito and other vectors, which will further growth the different diseases, and gradually it increases in our society drastically. Now, scenario of West Bengal. The number of dengue cases in West Bengal now 37,746 and death 46 as information available. In West Bengal, the disease also tackled under National Vector-Borne Control Disease Program. In West Bengal also, the state experienced active transmission of dengue at different urban, peri-urban and rural spaces. The reason is same: rapid urbanization, lack of awareness, poverty, deficient water management, lifestyle changes. So the reasons are same. The West Bengal also, the state suffers from this kind of dengue cases due to this program. Now, Prevention and dengue, prevention and safety measures of dengue. What the different aspects I would like to describe. Now, what WHO said in 2014, a very important word lines in his campaigning, that small bite and big threat, to educate people about vector-borne diseases. This is very important and catchy, but the meaning is very important. That the bite is very small. This mosquito is very small. When the bite is very small, but the after effect, the consequences are much larger and harmful. The threat is very big. So gradually it destroys our whole civilization. So if you understand the small bite, which is a big threat in our society, so if we have become aware, we can protect ourselves, then we can change our mentality, we can change our behavior pattern, then if we, by educating ourselves first, then to educate others in our society, then these vector-borne diseases, dengue or whatever, will gradually be diminished. Moving further, different measures. Dengue is a global threat that requires global response involving all possible partners. The global strategy promotes coordination and collaboration among multi-sectoral partners on integrated vector management approach and sustained control measures at all levels. Dengue is one of the major public health problems which can be controlled by active participation of the community. That is the main thing, active participation of the community. Need to be organized health education program about dengue diseases to increase community knowledge and sensitize the community to participate in the integrated vector control program. That is our sole motto, to make the integrated vector control program. Now I am going to discuss in very nutshell the different preventive measures to combat dengue. First one is personal prophylactic measures. Personal protective measures such as use of mosquito net or mosquito repellent, liquid, coils, mats. We all use. We all use. These are not new things, but we must not forget that to use it every day. And the thing is that these measures must also observe during the day because the primary mosquito vector bites during the day also. Next point is use of window screen. Window screen kind of, you can say it is a very good and effective, little bit costly, but it gives good results. Use of window screen, then insecticide treated bed net, vaporizer can be used to prevent mosquito bites. These are the measures. During transmission season, all the persons can wear clothes that cover arms and legs because wearing of full sleeve shirts and full pants, these things avoid the mosquito bite. So we can wear clothes and that covers our arms and legs. That is one of the prophylactic measures. And the last one, which is very very important, that dengue patient should be prevented from mosquito bite further. This will prevent further spread of dengue to other persons. That is the matter. You must know. If you know that you have dengue, avoid getting further mosquito bites during the first week of illness because virus may be circulated in the blood during this time and therefore you may transmit the virus to new uninfected mosquito and who may in turn infect other people. So it is we have to cautious for the dengue patient also to prevent from further mosquito bites. I have put some pictures to make it more interesting. That you can say the mosquito net must be uniform or light color for easy detection of the mosquito. The pattern is best is rectangular pattern is the best. There should not be any single hole. So mosquito net normal what we got in our market is normally easy, but it should be uniform in color. So very cheap and less costly. So we can bring for us very easily. Procure it. Next is repellent. Repellent are very easy to use. We can use easy to apply in our skin. So repellents are also available in our market. Other measures, different equipment, coil, mats, we all know. But the thing is, we have to use also in day also. We can also we have to use these kind of preventive measures, mosquito coil, other equipment, mats in our workspace also. This is the thing. And one thing, the use of bed nets for sleeping infants also, little children, because to prevent them from mosquito bite. So these things are not new, but sometimes we forgot or we avoid due to our busy schedule of life. Next is biological control. Biological control of mosquito through the use of feces. A wide range of feces feed readily the mosquito larva. We can use the feces in different sewage oxidation pond, farmer pond, borrow pit. So in recent years, there has been seen that the biological control become a good and interesting. They can control, but it is effective while other methods are used. So this is the biological control. Next is genetic control. In recent years, control of mosquito by genetic methods such as sterile male technique, chromosomal translocation, sex distortion, genetic replacement have been explored. The techniques have been potentially mosquito control and the technique has more efficient. Now chemical control. You can see there are many commonly chemicals are used. First one is mineral oil. The application of oil to water is one of the oldest known mosquito control measures. Very oldest. The most usually used oil are diesel, oil, kerosene, various fractions of crude oil. The oil kills larvae very easily and it has a specific toxic action. So this kind of mineral oil is used. Next is Paris green. Paris green are copper acetoarsenite microcrystalline powder, which is also very effective to destroy the larva of the mosquito. Then is synthetic insecticides. There are many synthetic insecticides, the organophosphorus compound, abate, fenthiol. So these are very effective larvicides. Then residual spray. Adult mosquito are most commonly controlled by spraying house with these residual insecticides. PDT is insecticide of the choice. Generally, it applied 1 to 3 times per year on the walls or surface where the mosquito rests. So the DDT is sprayed in our from our local authority. And last one is space spray. Here, insecticide is formulation is sprayed in the atmosphere in the form of fog to destroy the larvicide. You can see in the picture, I put a picture that spreading of fog. In our locality, sometimes this kind of fogging we have seen. These are the space spray. Pyrethrum extract is used in space spray, which kills instantly on contact of these mosquito, reducing the number of mosquito. And another is residual insecticides, where new equipment is used nowadays, ultra low volume space spray, ULV. Most extensively used are malathion for ultra low volume fogging. So these are the kind of fogging from our local authority, panchayat or municipality area. This kind of fogging we usually we have seen. Now, this part is very important, that environmental management and source reduction method. The most important step in reducing the number of mosquitoes is to eliminate their breeding space. So our role has to find out the breeding space. If you eliminate the breeding space, then our job is done. This elimination of breeding space is called source reduction. It is the most important landmark actually to eliminate the breeding space of the mosquito. So source reduction comprises minor engineering methods such as filling, leveling, drainage of the breeding space and water management. So these pictures I have put it commonly because this kind of scenes we are already habituated to see in our society, that tires are thrown away where water is accumulated, some tubs, some flower vessels, some buckets where rainwater accumulated, and right side is cement area where we can say too much actually. This water accumulated there, unused water actually, and this water, stagnant water, gradually helps in proliferation of the growth of vector of the vector of the dengue. And, gradually, it increases the disease of dengue in our society. So these things are kept in our mind. In Aedes mosquito, the environment should be clean. Got rid of water holding container, discarded clean empty pots, broken bottle, coconut shells, where artificially water collected. This picture also we can see that artificial collection of water. So what we can steps we can take for source reduction, preventing mosquito from accessing egg laying habits by environment management. So we have to prevent mosquito to access their egg laying habitats by destroying their breeding space. We have to identify the breeding space and destroy them. The proximity of mosquito vector breeding sites to human habitation is the risk factor. I have already told in the past the risk factor. If you are able to find out the risk factor, then it is our primary job is done. Then our duty is to detection and elimination of these breeding sources. So this kind of garbage, water accumulation are the source. So if we can identify or detect, then we can eliminate this breeding source. Then we can manage our environment very easily. Moving further, in case of environment management, the other part is disposing of solid waste properly, removing artificial man-made habitats that can hold water. Should have reliable water supply. Water supply should be reliable. Then proper covering of the stored water. So water should be covered properly. Should be covered with lid. It should not be open. Then water from cooler, other small container like plastic container, bucket, flower vessels, tires, water cooler, PET watering container. These should be removed at least once a week. Once a week we can clean them. Then management of our roof, sunsets, where we can actually avoid, we cannot see where water can accumulate. So this place should be clean. And last one is observation of dry day. So this is a weekly once a we can make this kind of observation to make uh, uh, clean the area where water accumulated. So we can maintain a dry day in a week. So this is a very important part. Moving further, we can say that the mosquito does places where they can breed in a wall, the flower vessels, in artificial made places, tires, bucket, whatever. These are the places where the mosquito, they are the breeding spaces. And how to avoid breeding from mosquito and prevention, we can clean them regular basis. These are the pictures actually I have put it to make it more interesting. Moving forward, now matter of our behavior change or awareness, so we have to take our health education program. This is the only way to change our behavior and awareness. Health education program can be done by audiovisual aids, television, sound films. There are different methods in health education program. First one is individual approach. Actually, I have divided this health education communication in three parts. One is individual approach, next is group approach, and last one is mass approach. So individually, through personal interview in the consultation room of the doctor or health center or home, this kind of interview or discussion can be done. Because what a doctor says it is very important regarding the health education. Because a hint from a doctor have more lasting effect than volumes of printed words. So this is very important. Then public health nurse, health visitors, health inspectors are visited hundreds of homes. They have plenty of opportunity for individual health teaching. We can also provide health education by personal letters also. Next, group approach. Health education can be provided by group approach also. First one is lecture. We can give a small lecture in our locality by healthcare providers that can also motivate. Then demonstration. Demonstration has a high value. We can demonstrate small things like how to clean our locality, how to cleaning water storage container, elimination of mosquito breeding space. So we can demonstrate. So it has a good impact of the people of our society. Next is group discussion, very effective method. We can discuss different health related issues of dengue. Next is panel discussion. You can make a panel discussion in front of a large group of person, so a good outcome will may come. Next is symposium. We can arrange. It is a large series of speeches. We can arrange. An expert can come and give his opinion. This is also a good approach. Then is workshop. Workshop is also good. We can make a training program or workshop one day program in our locality by approval, appropriate approval from our local bodies. Workshop also good to motivate, to change their opinion, to make aware the local people, common people regarding dengue or other vector-borne diseases. Then is role play. Role play is also interesting. It is a drama actually. A small drama can be arranged regarding the awareness program, health hazards, how to make clean. This kind of role play or drama is very important and interesting. Public may will make interest. So this kind of role play or drama is very important. We can arrange monthly basis or 2 monthly. This kind of small role play is a good impact also. Next is conference and seminar. We can arrange conference and seminar time to time to improve our knowledge. So this is a group approach. Mass approach has also its own way, effective way. Mass approach is a very one of the important. First one is television. Television has much potential of health communication. It not only create awareness but also change influence public's opinion because television is present in every corner of our society. So small audio, small clip, video clip regarding dengue or vector-borne diseases. So these kinds of clips or thing in TV, public may motivate. Radio has a broader audience than TV, so radio also has has own importance. Internet, computer-based communication system has opened vast capability of transfer of knowledge. It has a major health education tool. It is a very one of the major internet. So everything we can find out from internet. So it is one of the important internet. Next is newspaper. Newspaper is also motivate easily acceptable, accessible. So newspaper is also one of the way of health education. Next is printed material. Printed material means magazine, pamphlet, booklet, handout, whatever. These are the very easy. These are very easy, and the thing is we can produce in bulk, and the cost is very less, and can be shared by others, family members, community. So very easy to distribute. We can print in this multiple language in Bengali, Hindi, English, Urdu, and distributed in through schools, health center, NGOs, social organization, local councillor, door-to-door surveillance. So this is easy to distribute. So printed material has own impact. Next is poster. Poster and signboard very eye-catchy and create awareness. Hoardings, posters, these are actually capable of spreading awareness. Nowadays, in Kolkata, we are easily see that some hoardings or posters in bus, behind the bus, so regarding the prevention of dengue or awareness. So these posters have own impact. Another thing is auto rickshaw. Auto rickshaw is also nowadays used for carrying posters in their bag in regarding different information, important interesting thing in their bags. So auto rickshaw also playing a role, increasing a role for awareness of disease. So auto rickshaw, bus, they are also have own role for carrying the poster and signboards. Last one is the exhibition. We can arrange a exhibition. They can attract large number of people. It can also increase the knowledge and awareness. So exhibition we can arrange. It is also has mass one good population, number of population can come and increase their knowledge. So this part is also very important. We can uh, grow our knowledge by this different approach, and these are the different ways. Now community participation. There are three ways in which community can participate. Community can provide in shape of facility. The community can give facility, manpower, and logistic support. and possible funds. It can effectively involve in planning, management, and evaluation. People can make by this joining it. So community has own role. They can help every time. For prevention of dengue, following measures can be taken: sensitize and involving the community for detection of Aedes breeding space and their elimination. So in the picture I put it that the number of people here to detection of the breeding spaces. So without a group of people, this is not possible. So community, we need the help of the community also. Then educate the community on the risk of mosquito-borne diseases. What are the different mosquito-borne diseases? We can educate them by different programs. Already I have discussed different health programs, different approaches. Engaging with the community to improve participation and mobilize for sustained vector control. So this is also engaging. So community has always a wonderful role. By health education, this community can do actual their role to diminish the vector-borne diseases and dengue. Now, role of Kolkata Municipal Corporation. The Kolkata Municipal Corporation undertaking several measures to combat the threat of dengue in the city of Kolkata. What they are doing, first one, they are controlling the vector control. They are doing the different joint drives in case of any construction sites, market, hospital, school, police station. Any stagnant water or accumulation garbage immediately cleaned. Next, canals, other water bodies monitored and cleaned on regular basis. Volunteers are engaged in each ward. They are trained and carried door-to-door surveillance for detect dengue cases and to find out stagnant water. Different insecticides are already sprayed. So these are the points under vector control. Now they are doing awareness programs. Awareness program by distributing pamphlets, hoardings, signboards, posters, by different health programs. So they also increase awareness about the disease. And last one, they are appealing the disease of the citizens. They are appealing to citizens of the city because without the personal protection and responsibility of the person, this dengue prevention cannot be fruitful. So they are appealing to regular use of mosquito net. So that is the first thing I have already told. The use of mosquito net. Already we know. Check your home and surroundings any stagnant water. Reporting any stagnant water in your ward or municipality area. Checking refrigerator, air conditioners, where water may accumulate because these places are not visible. So always checking time to time and cooperating with the health worker. So these things are doing Kolkata Municipal Corporation. Wonderful job they are doing. Now, National Service Scheme. National Service Scheme is a central sector scheme of Government of India Ministry of Youth Affairs and Sports. It provides opportunity to the student youth to take part in various government-led community service activities and programs. The sole aim of NSS is to provide hands-on experience to young students, young and energetic, in delivering community service. This kind of community service or community approach they can do actually because their motto is not me but you. So actually they can come forward and initiate to clean their locality. They have their own role. Now, our last part was the COVID era actually. So what I have told in our introductory part, the actual approach of dengue and vector-borne diseases will be different this time because this kind of COVID pandemic is still persisting in our society. So the approach will be little different this time because one thing that I want to say is that COVID and dengue initially share similar symptoms, same kind of fever, fatigue, coryza, body ache. So it is very difficult sometimes to identify the healthcare provider. Once identified, it is very difficult the dengue patient to go to the facilitate the laboratory tests because chance of exposure is there. While going to the laboratory test, any hospital, government or private, there is a rush, there is a gathering. So there is chance of exposure of COVID. So while treating one disease, you will bring another disease to home. So this is a matter of very worry. So all the guidelines or safety measures of COVID-19 must be strictly followed in case of dengue and other vector-borne diseases also. So safe practices, what already you all know. I just point out the important point of COVID uh, safety measures, that maintaining hand hygiene, respiratory hygiene, social distancing, finding out the high risk group. These are the mode of transmission of COVID. We all know, touching, different coughing, public place. These are the, by the way, they are spreading very quickly. So what the thing is, hand hygiene. So hand hygiene we are already maintaining, washing hands with soap and water 20 seconds. When you go in a hospital for taking any health facility, then come to first your role is to cleaning or washing your hand for 20 seconds without touching your nose, eyes, ear. Then you can use hand sanitizer at least 70% alcohol base. This also can be used. Do not touch anything while you go outside. While you're traveling in bus, don't touch. Try to avoid the bus door. When going to the hospital, try to avoid the lift switch or any furniture. So these things try to avoid. Next is prevention by maintaining respiratory hygiene. These are the do and do nots. Do use handkerchief or tissue to cover your face while coughing and sneezing. Do not throw the use tissue immediately in a closed dustbin. You always throw this in a closed dustbin because these things may spread. And the third point, which is really important, that if you don't have any handkerchief or rumal in yourself, you can use your bent of upper arm while you have sneeze or cough or coryza. You can use your upper bend. So this will reduce the uh, spread of this infection. And wash your hand immediately after you have covered your sneeze and cough. So these things you can do. But you do not use other ways of covering. The gamcha, sari, do not use. Always use handkerchief. Then do not spit in open space or always use as a wash basin. These are the method of maintaining respiratory etiquette actually. Respiratory etiquette is one of the important things. Then maintaining social distance. When you go, a dengue patient will go in a hospital, there will be definitely a gathering. There will be definitely a gathering, a rush. Everywhere, while traveling, there is a gathering. In a hospital, there is a gathering in a laboratory. So try to, as much as possible, to make a safe distance, at least 1 meter, to make a safe distance. Do not go outside unnecessarily. So this is one kind of maintaining social distance you can make. What you make, do not go outside any market, shopping, mela, unless it is very much emergency. Avoid to use public transport. So always maintaining a social distance. These things actually from the day one or everything we know, but I'm just remembering these things because this pandemic is still persisting in our society. So we have to maintain these things also: hand hygiene, respiratory hygiene, and social distancing. And the last point, which is very important, identifying the high risk group, the older age patient, the older age who have this kind of heart disease, diabetes, lung disease, kidney disease, cancer on medication. These comorbidities are actually present in old patients, so we have to take extra care on them because we all know, because these old persons have less amount of immunity, they can prone to infection, COVID infection. So we have to take extra care on them. So we have to find out this high risk group also. Supportive public health services, community house, whatever, create a supportive environment, home quarantine, if anyone is suspected, so home quarantine, methodology, home care. So these are the procedures. So already I have told these things in case of anyone is suspected, keeping a safe distance, avoid visitors to the house. You should not roaming unnecessarily if you are suspected. Always seeking healthcare services if you have cough, breathing difficulty, coryza, fever, high fever. Then always wear a mask and immediately notify nearest healthcare provider. Avoid going to public area. Always use mask when you are around the people. So these protective measures must be used for the kind of presence of COVID. Now, what I wanted to say that we have to take care of our mental health also. We have to take care of our mental health care because lot of depression, anxiety, loneliness, stress arises due to this COVID era, and these things arises stress, fear, and stigma and discrimination. Why this kind of stigma arises? Nah, because of fear. Someone avoiding health facilities due to fear, fear of being infected, fear of losing livelihood, not being able to work, fear of being dismissed from work, fear of socially excluded. Someone will be excluded. If he identified with COVID, he will be socially excluded. So fear is always with him. Fear of losing someone, loved one, separation. So this kind of generate fear and stress. Fear of helplessness, worry, loneliness, depression, not working. So these things producing stress due to the fears, blame somebody for spreading the disease. So everything, these things making this person a mentally so much mentally stressful, loneliness. So this kind of generates stigma. So this level of stigma associated of with COVID based on three factors. COVID-19 actually is a new disease about which many things are still being undiscovered. When something unknown, people are worried, which leads to fear actually. Rumors or fake news gives wrong information and spreads to the fear. So actually this kind of fear, panic, anxiety, these things when a person feels this kind of panic, automatically he will next his mentally he become ill. And when he is mentally ill, his mental health, his sleep disorder, his appetite, his thirst, his daily routine is disbalanced. So one kind of socially isolated and discrimination feeling and stress above all is going on. So this kind we have to take care of them to this avoid this kind of stigma. What actually this stigma do? This stigma makes people hide their problem. They actually hide. If a dengue suspected patient, he has a fear. If I go there, I will be stigmatized. Someone may make stigmatized that I will suffer from COVID. Someone will not to take the healthcare facility. So he will avoid his common complaint, any other influenza complaint, not necessarily dengue, any other problem. He will hide themselves. So this point we have to know the community has own role to this kind of mentality to remove this kind of mentality keeps people away from accessing health service and seeking help. Actually they will remain home, they will not discuss their any problem to others, discourage them and may at times prevent them from adopting health behavior. They will not adopt any health behavior actually. These things stigma do. So what are the measures? Um, we can sensitize people and help them to understand that this COVID infection is a simple infection. 80% of the cases are mild cases. Already we have seen nowadays that maximum cases are asymptomatic and mild cases. So that is nothing to panic that to about to make a discrimination or stigmatized or any depression or stress. So we have to making just guidelines and aware. Make special efforts to reach out the high risk group, including senior citizen and younger. So we have to find out the high risk group and take extra care on them. Ask people to stay away from watching negative things. Negative things have also a negative role. Negative things, too much death count, too much uh, in today. So this TV fake news also makes anxiety. Try to avoid them. WhatsApp groups also help to give hope. Positive news you can spread to handle stress. So nothing to do. You can spread positive news to WhatsApp, not to negative. Advise people to engage in relaxing activity. The relaxing activity also a good role in reading, gardening, indoor games, home cleaning. This kind of will make your decrease your stress. Also increase your immunity also. Exercise you can do in your home. Engage community influencer. Share correct information on COVID. Always share correct information, not to any fake news or rumor to make create anxiety in our society. It is our role actually. And emphasize that most people are recovering from COVID-19. So it is, we have to encourage people that most people are recovering. So I have already come to our presentation in the last. So what I have already discussed that everybody has own role, healthcare provider, the community, the common people. But the main role is the person himself. Long ago, a medical historian stated that Henry Sigerist that the people's health ought to be concern of people themselves. They must be struggle for it and plan for it. The war against the disease and for the health cannot be fought by physician alone. Cannot be fought by physician alone. Physician cannot do everything. It is the pupils' war in which the entire population must be mobilized and permanently. The role is the pupils' war. So it's their role. They can mobilize everything. Dengue prevention and control should be everyone concerned. The role is everyone. Everybody has own role to play. Everybody. So it is our everyone's concern. And if we follow everything, I am sure in coming days the burden of dengue disease, the statistics, the death, the diagnosis will decrease and Asia will not represent the 70% of global burden. West Bengal and Kolkata and India globally will not share the number of cases increasing in the dengue. It will decrease gradually. So I have come to my last slide. Hopefully, I am able to explore different aspects of preventing and safety measures of vector-borne diseases, with special emphasis on dengue. As the pandemic of COVID-19 is persisting in our society, all the safety measures must be followed strictly. I have tried an integrated approach to discuss the topic in an easy and comprehensible way, so that everyone can perceive and follow it. With this, I would like to conclude my webinar by giving thanks for the organizer for providing me the platform to share my views on the topic, very important and relevant. Thank you all again, respected dignitaries, principal madam, and other professors, delegates to this for patiently hearing. Thank you again. Thank you. Thank you again. Dr. Hajra, now I am stop sharing my PPT.
Yes. Am I audible now?
Yes, yes, yes.
Yes. Thank you, Dr. Shaw, for such a long and enlightening speech. I think Dr. Shaw has presented comprehensively the prevention and safety measures of dengue and other vector-borne diseases in COVID era. Now, I would request to our Madam, Ms. Adharsila Chatterjee, to handle the question answer session. It's over to Ms. Adharsila Chatterjee.
Thank you, sir. Thank you, Dr. Hajar. And thank you, Dr. Shah, for this extremely relevant and informative session. I think your ability to explain the concepts with such lucidity and in such minute detail does not really leave much scope for doubt or confusion. But we still have received a couple of questions which we would request you to address. The first set of questions are from Dr. Devlina Gopalan. She is assistant professor in the Department of English from our college, from Women's Christian College. Her first question is, she asks, respected sir, could you elaborate on the genetic control of mosquitoes? Is it really a successful technique?
Can you repeat the question again?
Certainly, sir. She asks, could you elaborate on the genetic control of mosquitoes? Is it really a successful technique?
Really, genetic control methodology is really wonderful, and our uh, authority or administrator doing best their work. But genetic control methods, this kind of approach works needs a lot of fund and approval. And to apply this different methodology like chromosomal translocation, sterile male technique, genetic replacement, sex distortion. What I have told, this kind of methodology will take definitely good result. It will taking time, and actual application of this genetic control from our laboratory to the in our environment and society in our surroundings, it will little uh, problematic, little time taking, little I can say unfruitful, we can say, because it is a good process and huge amount of microscopic things can be done, lot of things should be done, but we cannot make all the mosquito sterile, we cannot make chromosomal translocation. So our thing is we this genetic control, chemical control, biological control, whatever, these things must be applied with other methods also. So other methods, that means personal protection and environmental management. So definitely biological control or genetical control have definitely role, and they are doing their best. So our research scientists, they are doing their best by making sterile mosquito by different genetic methodology. But this kind of tech will be little bit difficult to apply from their laboratory to in our locality. What I can say. So we cannot depend on genetic control solely. Definitely, it has a good role, but we have to apply other methods also. Thank you.
Thank you, sir. The second question is also from Dr. Devlina Gopalan. She asks, how has the pandemic affected the detection and treatment of dengue cases?
Can you repeat? Actually, your voice is echoing.
Certainly, sir. How has the pandemic, the COVID-19 pandemic,
Okay.
affected the detection and treatment of dengue cases?
Actually, this is a very good question, and this is our topic actually, that the presentation of COVID, cough, coryza, breathing difficulty, high fever, malaise, fatigue, the, these things symptomatology is very much similar initially with dengue. Dengue has also initially severe body ache, severe uh, pain behind the eye, high fever, little bit respiratory problem. So initially it is very difficult to discriminate clinically. I can say clinically a COVID patient and dengue patient. So we have to go for uh, laboratory. We have to go for blood test also. If you go uh, for suspected cases, if you clinically doubt that this is maybe a case of dengue, you can write down for detection of dengue test for NS1 antigen, ELISA, whatever, and the laboratory report will confirm. In case of COVID, you have to go for the RT-PCR. So the golden standard is the clinically you cannot confirm the discriminate the dengue and COVID, because initially their presentation is very much similar, even overlapping. Sometimes co-infection occurs. So the laboratory diagnosis blood test, we have to advise them, and after blood test, it will confirm the dengue and COVID, because RT-PCR is confirmatory. So you can do this kind of laboratory test. So these two things, when a patient suspected, we apply them, and after getting this blood report, there will be, it will confirm a dengue case or COVID case or both. Then the appropriate treatment will go. But with this, patient should take appropriate safety measures, different kind of. So this is not my point.
Okay, sir. We have a question from Dr. Shomnath Hajra,
Okay.
and he asks, what are the symptoms of dengue fever and severe dengue?
Okay. Simple dengue, simple dengue, we can say normal influenza like. Normal influenza like started with body pain, severe fatigue, high fever, malaise, fatigue, this kind of some kind of viral diarrhea. Patient sometimes may complain of like my legs are paining, I have body pain, appetite less, but fever will be there. severe pain, severe weakness will be there. This kind of simple dengue, and it will not control. And severe dengue, in case of severe dengue, there will be the hemorrhage will occur gradually. The platelet count will gradually decrease. Patient will suffer from shock. So patient will be must be hospitalized because patient will suffer from shock. Their electrolyte will be balanced, disbalanced. So it is very emergency case severe dengue that is hemorrhagic, sometimes associated with shock, sometimes without shock, whatever. But this severe dengue may take the person's die. So we must not wait for severe dengue. So in the initial stage, we shall uh, diagnose the case very early by clinically and then blood test, and then appropriate treatment must be given to them. Thank you.
Okay, sir. Thank you, sir. Sir, I would also like to ask a question since we don't have any further questions from the
Okay.
audience. I would like to ask a question. Uh, how do patients who have suffered from vector-borne diseases in the recent past, like
Hmm.
malaria or dengue, react to COVID-19? Are they more or less, conversely, less susceptible to COVID-19?
Can you again repeat your
Yes,
question?
sir. Yes, sir. How do patients who have suffered from diseases like dengue or malaria in the recent past or very recently react to COVID-19? Are they more susceptible to COVID-19 or are they less susceptible? How do they react?
Okay, okay. Thank you. I have got your question. Your question is there any chance that if dengue patient or malaria patient chance of more infection right now? Na?
Yes, yes, yes.
So what I can say, any infection, viral, bacterial, what the thing is, our response of the body, the susceptibility. So anything happen in our for disease, agent, host, and environment. The three things required: agent, host, and environment. So if a person suffering from dengue for many days, for 15 to 20 days, and fever remains, so automatically his immunity power, his body's defense mechanism will reduces. If the body's immunity power is reduces, automatically the person will become weak, lethargic, his appetite will be less. So this kind of person is susceptible to any kind of infection, not only COVID. He may suffer from malaria again, he may suffer from any influenza or anything. So this kind of person is very much susceptible to other infections and COVID-19 also. So this kind of person must take extra care. We should help them to increase their immunity by giving good diet, appropriate management, rest, whatever to increase their immunity and to boost up their immunity, and also proper sleep also. So these kind of persons of suffering from malaria, dengue, any vector-borne diseases or influenza, their immunity will actually decreases. So appropriate diet, rest, sleep, mental stress relieving will increase their immunity. Otherwise, they will definitely suffer from COVID-19 or any other further infection also. Thank you.
Thank you, Dr. Shaun, for patiently addressing all our queries. With this, we conclude our question answer session. I will now hand the mic over to Sri Oshim Chakraborty, Assistant Professor of the Department of Sanskrit, who will deliver the vote of thanks. Over to you, Oshim.
Thank you, ma'am. A very good evening to all of you, honorable dignitaries, and most valued guests. Being the joint convener of this program, it is my privilege to propose the vote of thanks on this webinar on behalf of NSS Unit, Women's Christian College. We want to express our gratitude to distinguished speaker, Dr. Praveen Kumar Shaw, who has spared his precious time for us and grace this occasion with his patience. He has discussed about what is the vector-borne disease and disease prevention, and we all know that prevention is better than cure. So it is very important part of this particular diseases. Not only this, all diseases, for all diseases, and determining factors, public awareness, strategies, compromises, and he has discussed present scenario in India, not only India, all over the world, and now the present scenario in West Bengal. Our sincere thanks goes to our principal madam, respected Dr. Ajantapal, for your vision and commitment to work and its execution. A high benchmark you have set for ourselves and never say die attitude help us to excel in all endeavor. I want to express my warm thanks to convener of this program, Dr. Somnath Hajra, Assistant Professor of Assistant Professor Department of Education, and also thanks to joint convener Ms. Adasila Chatterjee, Assistant Professor Department of English. Behind every successful program lie the manifold attempt of our committed faculty. I would like to take a moment to acknowledge the immense contribution of our dedicated faculty members. Our heartfelt thanks goes to all non-teaching staff members of our college, and also thanks to supporting kitchen and also hostel staff members. Finally, in the end, I would extend my wholehearted gratitude to our illustrious students. They are our pillar of strength. Thank you all for making this program a great success. Thank you.
হ্যালো, থ্যাংক ইউ অল। প্রোগ্রাম শেষ, আমরা আস্তে আস্তে মিটিংটা লেফট করে গেলাম।